Okay. Good evening. My name is Veronica. I'm the Client Outreach Specialist with the Gila County Health and Emergency Management. We want to thank you guys for joining us for this event. We hope that during this event you are able to get your questions answered, not only about the COVID-19 vaccine, but about COVID-19 and what we are doing as a county with our efforts. Now, I want to introduce our speakers and those who will be answering your questions this evening. I'll start from the top. We have our Director of the Health Department, who is Michael O'Driscoll. Carl Melford, he is our Emergency Manager. We have Stella Gore, she's our FET Coordinator and COVID-19 Investigations Team Lead. We have our Deputy Director, Josh Beck. We have Hoyt Scobbeland, I do apologize. He's the CEO with Banner Payson Medical Center. Todd Whitney, who is our COVID-19 Incident Commander. Randy Lowry, Senior Director, and then Rhonda Mason with CVRMC. She is the CNO. Now, we did receive a few questions previously asked from Facebook, and I wanted to start. One question that we did receive was when will vaccines become available and who is in charge of scheduling? I'm going to direct this question to Todd.
Sure, thank you very much for the question. That's a great question. When vaccines become available, and that's a moving target weekly, we've gone through allocations of 1,800 down to 500, 300, and back up to 1,800. Respectfully. So when those vaccines are ordered through us to the state, we then wait the week for the vaccines to actually make it in our hands to verify that the doses that were requested through allocation are actually in our hands. And then from that time, we're starting our scheduling of clinics. And so myself and my team are actually the entire team here and others that you don't see are tasked with all hands on deck scheduling this thing out. Whether it's the Banner Payson Clinic, Cobra Valley Regional Medical Center, or the county or other providers throughout the region, we all take a part in scheduling this out. And hopefully that answers the question. We look forward to any feedback online if I can give any help.
Okay. Thank you, Todd. Now, the next question that we did have was, is there any plan to assist the healthcare workers in getting vaccinated?
Sure thing. Thank you for your question. I wish there was a crystal ball that listed every single provider in the county at any given time. That's a moving target depending on the year. Clinics come and go. So we have forged relationships throughout the years with the health department and regional partnerships. We also encourage that reach to go both ways. So if there are health providers or clinicians or staff that have not been in contact, or we have not contacted you, please reach out on an email to us. You can reach out to me at twhitney, WHITNEY, at gilacountyaz.gov, and we can coordinate effectively.
Okay, great. Thank you, Todd. Now, this next question was, why can't Gila County Health Department create a working waiting list? And as vaccines become available, you just work through the list. Josh, could you answer this question?
Yeah, so we've tried having the waiting list before, and we kind of learn as we go here. The biggest issue with the waiting list right now is there's a couple of different ways that we register people in Gila County. The state came out with a system when this all started, and that system works really well for the large counties. And hopefully as it continues to improve, it'll work for us when we get to the general population. But right now so for the health department, for most of the events we've done so far, they've been what we call closed points of distribution. So those are where we work with hospitals, where we already know the administrative staff at those locations, and they can get us the phone numbers and the emails of the staff there. When we work with school systems, we work with those administrations, and we can get that list of staff and everyone we need. When we move on to what we call the open points of distribution, those are a lot more dependent on using our partners and knowing the amount of vaccine that we're going to be having on hand. So when we think of the wait list, the problem we have with that is when you have multiple partners, depending on how much vaccine we get each week, and so far we're on, I think, allocation number 8, and no week has been the same throughout those 8 weeks. So if we have a wait list, what happens is we're not currently using that state system in all of our locations. Right now, we're doing a lot of our internal public health registrations through Google Docs, or if we're working with small groups, we may even do those by paper and pen, just because it's easy with those small groups. Banner is, because of their corporation, they have a lot of hospitals in their system. They have their own registration system that they can use. It's effective for them and it's comfortable for them. And then Cobra Valley has kind of worked with us on trying our system and the state system, and they've come up with their own system that's comfortable for them and works for them. So once you have this registration list, if we have people on there and we open up these registration events towards everyone in the population, what happens is those people on the wait list, even if we pull our staff to start registering them, they can actually end up getting behind the people that would just be calling in anyways. And we really don't want to have that backlog. So complicated, yes. And if we get that state system, I hope that we can plan out further when we get to the larger general population, and in Gila County, the 65 and older population, which is pretty large as well. But as we're seeing right now, it's more efficient for the people in Gila County if we just have you sign up as those appointments become available with those open pod places, which right now is at Banner and at Cobra Valley.
Okay, thank you, Josh. And then just so everyone knows, anybody who is tuning into this live feed, you are able to go onto our YouTube channel and Facebook Live and enter in your questions, okay? Thank you again, Josh. And then let me see here. So our next question will be for Todd. Todd, we have a question here that says, please consider special needs assistance for those 75 and older with medical conditions.
Sorry about that. If I can just go back to the last question just for a second to clean up some things that are in my mind. So we're moving forward with a Payson Blitz event, if you were, next week, and we realized that there was a waiting list that was created during the last push up there. So next week we'll be up in Payson for 5 days, really working through that list very effectively, and by the end of the week, each person that's on that list will have received vaccine. People can expect a phone call or email in the next couple of days, and maybe even over the weekend to make sure that we can get everyone in. But we're cognizant of a list, like Josh had mentioned. It's a double-edged sword. Someone gets on a list, but at the same time, one of those vaccines come in. So we're making every effort this week coming to get through that list in Payson. So the question of please consider special needs assistance for those 75 and older with medical conditions. That's a great point. We've worked very hard with our partners at Banner and Cobra Valley Regional Medical Center, who are taking lead in providing that higher level of care when we run clinics. If the county health department runs a clinic out in the field, as I call it, whether it's a school gymnasium or a drive-through clinic, we have medical staff at the level of medic, military medic, and that level of care is good for most instances. But again, looking back at this question of that special care, we want to make sure that the residents that are looking for these vaccines get that best care possible, and through the partnerships of the hospital, I think we've met that mark.
Okay, thank you, Todd. And then just a reminder, for our vaccine management system, there is a 50-mile radius. So whenever you are going in onto that, there is that 50-mile radius for you, okay? Now this next question here is directed towards Josh. Josh, when do you anticipate providing the vaccine to ages 65 plus?
Well, at the current moment, we just started the 75 and older population, which is a little over 6,000 people. So I'll say the first portion of guessing out what the time frame would be is, do we continue to get the amount of vaccine doses that we're receiving a week right now? So we have to put a big if on that. So far as we said earlier, the vaccine doses that we've received each week from the state and federal government has been different. It looks like it's going to continue and be consistent about what we're receiving right now. So if we assume that we're receiving somewhere between 1,000 and 1,500 doses a week, then we can look and say we know that population is around 6,000, a little over 6,000 people. And we know that we still have the essential services, critical workers that we're still have to do, which is a rather large group as well, because we're talking our, when you're getting into groceries, those type of workers, fast food, the people that have the opportunity to greatly spread the disease would be those people we consider in that group. So in order to get to 65 and older, we need to get to those first. So if we're talking about 1,500 doses a week, and again, that's an if. And then the other big if is depending on what industry or what label within that chart that we've been doing, we're looking at different percentages of people that are vaccinating. We might get 40% of one group, or as much as 80 or 90% of the people in one group, like we did with the teachers up in the Payson area. So depending on, if 50% of that 6,000 group get the vaccine, or 80% of that 6,000 group get the vaccine, again, that would be 2 or 3 weeks longer for it to get through there. But I mean, if you put all that in and someone just wanted to know about what they're looking for, I know a lot of the reason this question comes up is because, we do have the big vaccination sites in Maricopa County, and some of the people are wondering, is it worth waiting for those vaccine sites if they sign up now and get registered for mid-late March? Those are already booked. If they get back on, do they sign up for April? So the thought process in Gila County is, I would really say it looks like we could be there, especially down south as Cobra Valley continues to go through the residents at the pace they're going right now, which is wonderful. Late February or early March, that would be if everything holds true and we continue to get the vaccine allotments we're getting, and we get a good portion of the population. I would say, if you were hedging your bets, that late February, most likely early March, would be the time we could probably open up to the 65 and older population.
Okay, wonderful. Thank you, Josh. So this next question is, when will the vaccine be available in smaller local clinics?
Is that one to me, or is that to Todd?
Josh or Todd? I'm sorry.
I can take that, and I'm actually going to have to lean on the Banner Hospital. I'm sorry, Cobra Valley Regional Medical Center too. So the smaller local clinics, when I look at that question, not knowing the context, I think of Tonto Basin, I think of Young. There are 2 clinics in those regions that Cobra Valley Regional Medical Center currently has. And so working with that partnership, they will be working on a timeline, not yet defined, on providing vaccines to those regions. If the context is why more local doctors' offices are not providing vaccines, there's a process to be registered through the state of Arizona in order to be validated to provide vaccines. It's kind of a lengthy process, and so we have about 10 partners right now in the county that are providing vaccine across. And so hopefully I've hit both sides of that context and answered the question.
Okay, wonderful.
I can follow up on that a little, Veronica.
Okay.
For everyone to understand the math of this, and this kind of applies to the answer to a lot of these questions we're looking at, is that these vaccine doses come in sets of 10 that need to be thawed out. And so a lot of times with the local clinics, that can become complicated because you're not positive, setting up a registration, even at the health department. As we've said, it's difficult with the call centers and stuff to be able to keep up with the population in Gila County, and asking that of some of our smaller clinics is even more for them to open up a registration or something and try to do that for such a large population. and to not know, one, do they have the freezer, the fridge or freezer space? We haven't done the ultra cold storage yet, but even with the fridge, there's specific rules for the vaccine and how it must be stored. The temperature has to be consistent every night, every day, 24/7. And a lot of these things can be really complicated for the smaller clinics. So, I would preface and say, don't feel like a lot of those clinics wouldn't want to be doing this if they could, but it is a complicated process that the hospitals and the health department are much more used to because of the vaccine for children programs and other programs that we have, that this kind of falls more into our specialty wheelhouse than what some of the smaller clinics can handle.
Okay, thank you for answering that. And then just to point out in regards to our vaccine management system, with that 50-mile radius, it can lead to people who are out of the county to signing up. So that has been an issue for us, and we are currently working on correcting that. Todd, can you emphasize more on that?
Sure thing. Thank you. So the vaccine management system, like Josh had mentioned earlier, it's a state-run system or state-built system. It's working at the State Farm Stadium, will be used at Phoenix Municipal Stadium. I've visited both those sites. It's working well for the open clinics for everyone to attend. Now, when vaccines are distributed at the state level, it's at 15 different counties receive the allocation based on their population. So if we were to open a vaccine management system portal and keep it just for Gila County, yet leave it open, everyone in the state could actually intentionally come in and go through the appointments, which were actually geared for the first responder or the health department or the health staff of Gila County. So as we continue to roll this system out, we find ways of ensuring that we can work this system to better respond to Gila County residents. Josh, do you have anything else on that?
Well, this is the big one that it's such a tough question to answer. We for everybody that's watching, we try to get on Facebook and social media and answer a lot of these questions when we can, but this is one of the more complicated ones. It's kind of difficult to just ask or respond to in a quick chat online. The problem is there's a reason. Arizona is an interesting state because of the size of the counties, and so when they created this vaccine management system, what Veronica was saying a little while ago about the 50-mile radius. So what happens is if you're in Chandler or Mesa or something, and you want to know what vaccines, because there's so many people in Maricopa County, they want that 50-mile radius because you might be able to hit 10 or 15 different pod sites here in Maricopa County, and that's not really an issue to you. Allowed them to go in and set different parameters for each different county. So when we open a vaccine clinic through the state's vaccine management system in Gila County, there's a good portion of Phoenix that is able to sign up for that. Unfortunately, we did the right thing, and we put questions on there saying you have to be a resident of Gila County, and then here are the parameters, and we're going to check that when you get here. And as our friends at Cooper Valley realized, that didn't really stop a lot of people from signing up, and it's not really there's a specific reason why each county is doing the vaccines the way we're doing it. The vaccine is divided by the populations of the counties, and that's how it's administered to the counties. So if we want to vaccinate our populations, we can't be vaccinating other populations. So there's no feelings or anything involved. It's just simple math that each county is going to vaccinate their population because those are the census numbers we're using. And in order to effectively vaccinate each population, those counties have to hold to those lines very clearly. And I suppose that's the trick. If some of these things seem more complicated, we'd love to use some of these systems, but ultimately we're trying to protect the people in Gila County and make sure that our vaccines are for us.
Awesome. Thank you, Josh. So I do have a question that did come in. Are there resources available to help the 75 plus register for vaccinations, since it's done online and many seniors don't have access to computers, internet, or possibly family help?
Todd,
would you be able to answer that?
I'm sorry, I lost the audio for a second. If you can either repeat or Josh can take that.
Yeah, I can repeat. So are there resources available to help the 75 plus population register for a vaccine, since it's done online and many seniors don't have access to computers, internet, or even family help?
Sure thing. So Cobra Valley and Banner both have opportunities for that population to connect with. In addition, we're working with the CERT team and other volunteer organizations in the north part of the county to provide that assistance as need be. But truly, going to Banner and going to Cobra Valley Regional Medical Centers, and I believe Scott will be putting up on the ticker on the bottom those contact information pieces so people can actually reach out and touch a live person.
Okay, wonderful. Thank you. So back to the previous questions. Give me a moment here. And this question is for Michael. Michael, does the vaccine allow participants to go without a mask or stop distancing? If so, is that immediately or how soon after the vaccine is administered?
Good evening, everyone. So that's a tricky question because the latest data that we've been given by the CDC has said that it might be 85 to 90% of people needing the vaccine to acquire herd immunity. And we are moving as fast as we can through the community with the vaccine, but we're certainly not going to get to 80, 90% of the residents in Gila County anytime soon. So then that poses the question of, can those people who have received both vaccine shots go unmasked? And the answer is probably it's still a good idea to wear the mask because we don't know who's been vaccinated and you still want to protect everybody. And so we would ask until some of the data comes out from the CDC and some of the research in the near future, everybody keep the mask on, even if you have received the vaccine, and continue with the social distancing, because we have seen around the country that when those things are implemented, it does work and the cases do decline. And in Gila County, we're still very high with our cases. So we'd like to see that decline each and every day, especially to protect the most vulnerable, which are the 75 and older currently right now.
Okay, thank you, Michael. So we do have a question that did come in. Josh, I'm gonna see if you can answer this. I hear vaccines are going to be available through Fry's. Is that something the county is involved in?
So this one gets interesting as well. So there's a lot of different ways that the vaccines are being administered right now. At the county level, as we've said, we get to, so basically an allocation opens up on our vaccine portal each week. And our team gets to look at how many vaccines we get, and we work with Cobra Valley, Banner, and all of our partners, and we assign those out to all the partners that we work with. Each one of the counties does that, and that's how they set up their events each week. Above that, you have the state, which holds on to a certain percentage of the vaccines, and that's how they're doing the large vaccine pods at the two stadiums. So those are actually those two events that are doing the 65 and older at the stadiums is all done through state vaccine. Additionally, the state takes off the top of that cut the amount of vaccines that are going to all the skilled nursing facilities and long-term care facilities. That's being done with a separate contract with CVS and Walgreens. Now, the latest thing that they're doing is there's a federal partnership with the pharmacies throughout the country to get the vaccine out to the pharmacies. And this is coming straight from the federal government. As far as Mr. O'Driscoll and I know at this moment, there was one pharmacy in Payson that had received clearance to give the vaccine. We haven't actually seen the Fry's on the list, but we've heard from a couple people today that the Fry's is there. We're still waiting for confirmation from our contacts at ADHS, but again, that's a federal partnership, so it's possible even the state is behind on who all has been able to sign up for that. So it's possible, Fry's Kroger is an extreme alarm corporation, so that wouldn't surprise me. And then, we might as well cover the what would you call it, the white whale or the rhinoceros in the room, and that is that for everyone to know that as these pharmacy partnerships do come on board, the federal government is working with anybody that they work with is allowed to go by the federal regulations, which right now would be anyone 65 and older. Also, those people that have special healthcare needs that are affected by COVID-19. So you're going to have those federal partners running on one timetable or one table of who can get vaccinated. You're going to have the state health department at the stadiums running on the 65 and older group platform. And then, as far as I know, all of the counties are still in the 1B and 1A categories, and Gila County would stay there as well. I suppose that would be the answer, unless you have something else to add, Michael.
The only thing I'd like to add is it does get confusing when you have the federal government running one program, the state running another, and the county running the third type of administration program for this vaccine. So we have, as a health officer group, voiced our concern to the federal government, asking that the pharmacies follow the local health department guidelines and follow the age groups that we are in currently. So we do have that request in. I'm hopeful that the state and federal government will listen to the health officers, and we will wait and see. And if that does happen, it'll be fantastic for a lot of counties around the state of Arizona, just to avoid some of the confusion that could come in. If you're running 3 different administration systems in a county, especially one as rural as Gila, it's gonna create a lot of confusion to the residents, and we don't want any more confusion that we know is happening out there. So, and that's all I have to add, Josh.
All right, thank you both. So our next question that came in was, Stella, I'm going to direct this to you. After you are fully vaccinated, can you still pass COVID to others who are not vaccinated?
Stella, you're on mute.
Sorry. That's a great question. And the short answer is we don't really know yet. So a lot of data is saying that you would be fully protected and you wouldn't get the virus, but there are some data and research out there that's saying that just because you're vaccinated, you may not get sick, but you still could have some of the virus alive and able to replicate in your system, and you could possibly pass it to others. That's another good reason to continue to social distance and wear a mask, because this vaccine is under emergency use authorization. Children under 16 can't get it. So that we need to protect our children also, as well as our seniors. Josh may have more to add on that one.
Oh, we always preface, there's not a doctor on this committee right now, so we always say, ask your doctor for the true medical advice. But as a researcher, I can just put out the reason that this question's out there right now is because typically why public health is usually really good at fighting any kind of disease is because, like the reason SARS and MERS and Zika virus and all these other vaccines or all these other diseases didn't spread like coronavirus does is because we're very good at attacking a disease that doesn't pass on to people until something's symptomatic. So with a normal disease, since it doesn't spread until someone's symptomatic, the contact tracing work that we do is pretty phenomenal throughout the world. COVID-19, we look at that 24 to 48 hour window where many people, and then this is the people that show symptoms, not even getting into the asymptomatic people. But with COVID-19, you have this window of time where people seem to be able to spread before they are showing symptoms. And that's what makes it complicated. That's why the masks and the social distancing, the limiting gathering, everything is so important, because it's not that we can't still do our job, but any amount of contact tracing and everything we do is always going to miss that small population. So the question that's why the question comes up around the vaccines is with most diseases, if you can't really get the disease and you never show symptoms because your body fought that off for the most part before you were able to spread it, then it makes sense that with the generalizing with most diseases, you don't have a problem once you're vaccinated. So the reason the question comes up, and still is correct, there's not enough research to say right now, but we do generally know from other vaccines that doesn't typically happen. but that's the reason we don't know yet, is because COVID is a little different in that it does have that spread before you've really fought it off with the vaccine. Um, One thing I can say, I don't know how much Stella's read about this, and everyone can continue to read up on this, and we'll find more as people continue to get vaccinated, is that the people that get really sick from COVID is typically, we know it's based on the amount of COVID particles that you take in that get you sick. So those people that would be spreading it, if it were to be spread by vaccinated people, wouldn't be shedding very much of the virus through airborne particles or anything. So the chances would definitely be less if it was there. But yeah, everyone's going to have to stay tuned and just kind of see how that plays out. I guess it's kind of why it's important. We say, and I'm sorry, I'm the talker of the group for everybody that's out there. But, one of the big questions everyone said at the beginning of this is what % of people that we needed to be vaccinated or to have COVID to get the herd immunity. And, the original estimates were, it can be anywhere depending on the disease from, 60, 70 to 90%. You see at the beginning of this, most people were assuming like some of the other coronaviruses in that family, like a 60 or 70%. And now I know Dr. Fauci and a few of the others are saying probably more upwards of 90 to 95% for human herd immunity. And again, that's why the vaccines are so important, is if everybody has it and we get 90, 95% herd immunity, then it wouldn't matter if there was asymptomatic spread because everyone would be vaccinated anyways. So another plug for why the vaccines are so important.
Okay, thank you, Josh. Thank you, Stella. So this next question that did come up was Maricopa County just announced they are accepting walk-up appointments for a future time. Can you guys do this? I'm going to direct this towards Josh.
One of the biggest reasons we haven't one of the biggest reasons we haven't done this yet, and this week is really the perfect example, so this is a good week for this to come up, is with the snowstorms this week. All of the northern counties received their vaccine shipments late, so almost everybody had to pause their vaccines this week. Even in Maricopa County, due to the winds and the rains, tables flowing over, it's really difficult to store your vaccine temperatures outdoors during inclement weather and make sure that we're following all the vaccine protocols. So there are things that can come up that throw the schedules off. So if you say do what the state did, and for whatever reason, not picking on them, but if you do what the state did and you put your schedule out till the end of March, and you have 2 days, 3 days, even 1 day where you have to close down and push all those back, that's a lot of effort to move all those back. And we would prefer to, on the local level in the rural counties, we kind of prefer to not have to do the extra work. We'd rather use that time to get people vaccinated and base each week's appointments off the vaccine that we have, so there's no surprises. It takes a lot to, when we run a call center, when we change the registrations, that's a lot of manpower and the amount of human resources that we have are limited. So we try to put those in the most efficient way, in the most efficient pots that we can. And for us, that's continuing the contact tracing, which is a large part of our team. And then the rest of it's working towards the vaccination goals. So if we can limit the, I'll throw the wait lists there too. If we can limit the wait lists and we can limit the amount of planning ahead that we do as far as registering people too far into the future, we don't have vaccine, then we eliminate those headaches and we can kind of keep doing what I think we've shown so far we're pretty good at, and that's receiving vaccine and getting it out each week.
Perfect, Josh. Thank you.
Veronica, would it be okay if we have Hoyt from Banner to sort of go over what Banner is doing up in the Payson area, how they're running their clinics, and then after Hoyt, maybe ask Rhonda from Cobra Valley to sort of let the public know exactly how their clinic is set up, because they're two different systems, and it's good to have the public know exactly what each of our community partners are doing. So Hoyt, would you be able to answer that?
Yes, and Mike, before I do that, if I could just comment on a few things that have been said so far, just as encouraging masking even after vaccination. One of the benefits of that is the impact that we saw in the Southern Hemisphere on the flu season, and we're seeing here in Arizona and across other states that when we are masking and hand washing and social distancing, we're experiencing one of the best, I don't know if the right word to describe a flu season is best, but one of the lowest rates of flu influenza that we've seen. That saves lives. We don't talk a lot about that but we lose lives every year due to the flu. And so this, for all the reasons that Josh said, we can't be for sure. And what Stella said, why do I have to wear a mask? I'm not going to be infectious. There is some infectious risk, but mostly it's hard to manage, as you said. One of you said, how do we manage who had the vaccine, who didn't? And people are going to be afraid of people that are not masked, et cetera. So just wanted to throw that in, that it's helping. And I would tell you that our hospitals and health systems in Arizona have been overrun. You know, we've been on the edge. We've managed this well. We've been able to treat every patient. No patient in the state that I know of has gone untreated. But if we were to have a flu influx, that would complicate our efforts in caring for those who require hospitalization with COVID. So just for a number of months more in 2021, if we could all be cooperative and continue to mask even after vaccination, out of respect for those who are suffering with COVID and for those caring for those with COVID, it would be really challenging to have both COVID and an influenza spike. So thank you for that. I just wanted to mention that. And I'm going to defer my answer largely to Randy Lowry. Randy's our senior director of our clinics. We've chosen to conduct our vaccinations through our Banner Medical Group, Banner Health Clinic, our primary care site at 117 on Main Street. And we are caring for other patients while we're integrating the vaccinations. And as I've said, we're using hospital staff when we can to supplement our clinic staff. But I'll let Randy briefly describe how we're managing to administer Mike in answer to your original question.
Thanks, Hoyt. Yeah, so at the clinic, like Hoyt said, we're also managing our day-to-day primary care so that we can make sure that, you know, we're still available for patients for everyday needs. What we're doing is running vaccine clinic at the same time throughout the week, Monday through Friday. And then on Saturday, when we're not open to normal patient care, we have opened up for most of the day from 8 to 1, and we're doing a majority of our vaccination on those Saturday hours. We're trying to bring in as much staff as we can so that we can, you know, administer as much vaccine as possible on those days. We have people that travel up from the valley to come up and help the staffing of the clinic as well. We also have to maintain social distancing while we're administering the vaccine. And so, you know, we can't just have a walk-up clinic and lines of people kind of coming in through there for a lot of the reasons that you all mentioned before. We have to, you know, thaw our vaccine, make sure that we have adequate counts for it, that we're not wasting doses. And we do everything possible to make sure that a dose is not wasted. If we have to start calling people at the end of the day because someone no-showed, we'll do that to make sure that something's not wasted. So that's pretty much how we've been running it. We keep trying to think of other ways that we can go bigger and better, but it also comes back to the allocation of that vaccine as well. So I can, you know, build as much staffing and availability, but if I don't have the vaccine to give, then it's not helpful. So that is how we're currently running it.
Great. Thank you, Randy. And Rhonda, down in the Globe area with Cobra Valley, could you just briefly explain how you guys are doing your clinics and let us in on all that information?
Sure. Thanks, Michael. So we've had multiple changes over the last 4 weeks in how we do provide our clinics. We've worked really closely with the county and appreciate all their support. Currently, well, I'll back up. So we were using the county to help us schedule, which was great. We did spend a week and we tried to use the state system. Probably 50% of our patients who signed up on the state site were from Maricopa County, and we had to turn them away. So we opened it up to a walk-in one afternoon. I agree with Randy, that is not the best way to efficiently get people through and social distance and et cetera. So this week we actually opened up our own scheduling through our electronic medical record. We've hired 15 temporary staff. A lot of those are clerical to do scheduling and then to register when people come in. We have a fairly good process to easily get about 200 to 250 people through every day. And starting next week, we'll do first doses on Tuesdays and Wednesdays, second doses on Thursdays and Fridays. And as long as we have vaccine coming in, that's the schedule we'll continue to follow.
Thank you, Rhonda. Now, I do have a question that did come in. It says, Todd had talked about contacting people who are on lists. How does one get on a list? I keep getting the response that no appointments are available and instructed to keep checking back. Todd, would you be able to answer?
Without knowing the context of that, Veronica, I'm going to imagine that it's probably a system. I think Banner was working with a system that they allocate, when they have vaccine, they allocate appointments to that. And then when there's no vaccine available and the appointments are actually not there. So without knowing the context of exactly where that would be coming from, I would be happy to take a further conversation with that person. Again, my email address is twhitney@gila.countyaz.gov. And I don't know if Hoyt wants to maybe chime in on that, if that may bring it up.
It is one of our limitations, as I thought Randy and we've all described, is it's hard to schedule in advance without knowing how much vaccine we're getting. So on a weekly basis, we release on our website the additional appointments. There are occasional cancellations. However, I would say there aren't many, except for when it snows, I suppose, but we had to call off our clinics. But there are cancellations, and so you could check daily, and you might find that there's a cancellation. A clinic appointment becomes available. But in reality, we're waiting with Josh for the allocation that the county receives, and we wait to hear how many doses will be made available to us, and then we update the schedule to accommodate those additional doses. I'd also mention that you might be interested to know, as we're managing this, Rhonda and Randy, we're also managing second doses for healthcare workers. So you have a very narrow window to administer a second dose to be effective, or else you've wasted the time and the opportunity. So we're managing. We are all very effective by a very specific criteria that the CDC has, the Center for Disease Control, that we're all adhering to perfectly. And in doing that, there's so many moving pieces and parts, and the safety of the community member receiving the vaccine is our utmost concern. We're probably the most motivated, those on this call, we're as motivated as anyone to vaccinate everyone as quickly as we possibly can through these tiers. But my mother had COVID. She was hospitalized. I understand the fear. I understand the anxiety. I understand the intention to get vaccinated. So it's disappointing when we're not able to field every call quickly, to take in everyone as soon as they want. So I would offer this suggestion. Checking the website on a weekly basis will be the most productive, because we'll likely see large number of appointments open up on a weekly basis. On a daily basis, certainly look if you'd like, and you may be lucky to find a cancellation, but because of the anxiety, people wanting to be vaccinated, there are very few cancellations. I don't know, Randy, if you have anything to add to that.
No, I think you said it well, Hoyt. It's a balancing act for us right now for delivering those second doses to the healthcare workers that we started with, and then adding in our 75 and older community. And as the healthcare workers receive their second doses and move off that schedule, it opens more availability for us for the 75 and older community. And to your point, very rarely do we have people who are canceling their appointments. And we do, occasionally from day to day, you might have one or two appointments open. And even if we pull a extra dose out of a vial, we put an appointment slot out there and it's gone within seconds for someone to come in and get that. So we are trying to get the availability out there as quickly as we possibly can.
And if I could just add, through the phone number that we have implemented, we just started that on Tuesday. people can leave a message, and we are working those messages every day until the wee hours of the evening. So I would just encourage people, if you call and leave a message, to just give us a few days to get back to you. I had a gentleman talk to me today, and he said his wife has left 6 messages, and I said, well, we could, just one message is plenty. We'll get back. So there are a lot of people wanting and feeling anxious, I'm sure, about getting this vaccine. And Hoyt said it, we want to make sure to vaccinate our communities. So we just need a little time to get through those lists and make sure that we are getting people scheduled and getting them in.
Could I add in, Veronica, I hope that's okay.
Of course.
I thought that question raised at the beginning of this session was really important, and that is those that are not computer literate or don't have access to the computer side. I'm really grateful for the CERT group that was mentioned earlier by, I think, Todd. They will be, we're partnering, we operate in 6 states, we operate in many counties, and we're trying to learn from our collective experience within Banner, and sometimes that can be challenging to understand because we haven't experienced it locally, but we do feel that the approach we're taking, partnering with the county, is ideal. And so with CERT joining in that partnership, they will actually have volunteers who will be assisting people in registering and scheduling appointments. So it won't be perfect. I love what was said earlier. If we're estimating there's 6,700 75-year-old and older residents in our county, and if we're getting almost, hopefully, 2,000 doses a week, that could be far less, depends on what happens with weather, etc. We're going to get through this in a couple of months, and we know that everyone wants to be vaccinated tomorrow. We wish we could vaccinate you all tomorrow as well, but just appreciate the partnerships at the county and their leadership, and appreciate your patience with our limitations.
Thank you, guys, and we appreciate all of you. So the following question, this question is for Todd. Is the Gila County Health Department having any upcoming clinics in Payson? If so, what are the dates?
To report out on all evening. Thank you for the question. I'm actually going to expand that a little bit in a timeline manner, if I can, to include Southern Gila County. So tomorrow and Friday, the Freeport McMoran mine in Globe will be hosting a closed pod. Josh had mentioned a closed pod being that focal group of employees, and I am optimistically looking towards 400 doses going out in 2 days. So if that comes to fruition over Thursday and Friday, the employees that have signed up through Freeport McMoran's closed pod will be able to receive those doses. Now, moving forward, the 30th, which is Saturday, the Payson region, we had Ponderosa Family Care in conjunction with MHA and the CERT team and the town of Payson. Big operation for second doses. Due to the upcoming snowstorm on Friday into Saturday, that's been pushed back into next Saturday. So the same exact location, same exact time, same exact schedule, just pushed back 1 week. If we fast forward into Monday through Wednesday, the closed pod for Payson Unified School District and Pine Strawberry School District will be in session. We are going to run through those second doses. Excited to get those people vaccinated for the second dose. But we're doing something further. Michael O'Driscoll was a champion going to battle the state on asking for more vaccine. We're going to double our throughput for Monday through Wednesday. An additional 330 doses will be scheduled and administered through those 3 days. And then on the 4th and the 5th, we're going to stay in Payson in conjunction with Ponderosa Family Care, the LDS Church, and several other partners will be in the region. We'll be administering many more doses. I'm excited. It's just south of 1,000. So I'm excited that those numbers are there. keeping in mind that scheduling is ongoing, the last couple of days. And again, if you remember what Josh was saying, we don't know what the doses are going to look like until they're actually in our hands. So now that we have adequate doses, this is the week we're scheduling for next week. So I stopped on the 5th. So the 4th and the 5th will be at the LDS Church in Payson. And then again on the 6th, getting those second doses for Dr. Michael's Ponderosa Family Care that were going to happen on the 30th again are going to happen on the 6th. So in total, I'm hoping for about 1,600, 1,650 doses in 1 week in Northern Arizona, not to include the Freeport-McMoRan's 400 doses tomorrow and Friday. I hope that answers the question, and I hope we have more doses and I can report more further a later day.
Thank you, Todd. So we do have another question here. This question is for Josh. What about leaning on cultural centers of the community where people are already gathering, such as churches on Sundays, to do walk-up vaccinations?
Well, those are actually great ideas. The biggest issue right now is we just don't have the vaccine. So, I think our output right now is in the upper 2000s of how many vaccines we could put out a week just with the partners we have. And we just don't have the vaccine to do that. As we move on to hopefully when we get to the general population and more vaccine available, then the issue that we have is just really the efficiency of it. We've been practicing these open point of distribution exercises for the last really 5-10 years, probably further back than that, where we at High Desert Middle School and I don't remember where you guys did the one up north, Carl, but we've been practicing these open point of distribution exercises just for reasons like this, where we have to do mass vaccinations and maybe not to the scale of what they're doing at the stadiums in Maricopa County, but we actually have the potential ourselves to put through, probably 500 to 600, maybe north of 1,000 vaccines a day at some of these sites if needed. We have Todd, part of the reason, so those who don't know Todd Whitney, he was our emergency manager before Carl and the former emergency manager for Coconino County. And we kind of have the expertise right now with our team and who we've brought on to really lean on not just our strengths, but the strengths of the National Guard and some of these other county partners that we've known before. And we really have the potential for a lot more vaccine than what we're giving out right now. So, that's really good news for everyone in the county that as the vaccine becomes higher, we're not really limited right now by our output or by what we're able to do. We're just limited by the amount of vaccine we have. But definitely even at the end of that, when we're done doing those larger pods and those type events, in my opinion, that's how we finish out and kind of clean out and try to get to that 80, 90, 95% herd immunity of how many people have been vaccinated, is we reach out to those. I think that's really when you get the cultural centers, the senior centers, all these little areas where not just getting the vaccine out, but getting more information about the vaccine out to kind of round out those rural counties, the rural areas, the people, the naysayers, the ones that we need to get get that population percent up. And that's kind of the all hands on deck that happens at the end of everything.
Okay, thank you, Josh. So we do have another question that did come in. If a person has medical issues that would allow them to get the vaccine in 1C, what verification do you need to have? Letter from doctor, RX bottles? I might direct this towards Rhonda.
Sure, thank you. So just to clarify with people, I'm sure people understand that we are not at 1C quite yet. But as we schedule people, we quite often will take their word for their medical history. So we are not currently requesting anything. We've talked about that when we get to the next phase, when we open up 1C. I'd like to be able to trust that people are telling us, truly what's going on with them, and we can get them in. So if we run into any issues, we may require some type of proof of medical information. But currently, the conversations we're having is that we will take them for their word, what their medical history is or their medical conditions are.
I think it's worth adding on those words, Rhonda. I volunteered at our clinic on Saturday. I think we stooped low to the bottom of the barrel, and I was the greeter screener, and I really enjoyed it. I'd have to say one thing. I don't know that I've ever seen. We had 100 people that came through, over 75 and older. They are the most prompt section of our society. It was so refreshing. There was no one that was late. They were early. And that was wonderful. And it was a fascinating, high caliber cross section of the facility. I'm sure, Rhonda, you'd agree, of the community. Some of the best people we have. I have huge respect for the seniors in our community. So it's an honor to serve that audience. But there is the screening criteria, and that's part of our website registration process, is prescribed by the CDC. And you'll find that unlike other vaccinations, this was the most scrutinous intake process I've seen implemented. And that makes this process, it's not as quick as you might expect if you were going in for any other vaccination, like a flu vaccine. I just wanted to add to that, Rhonda, that in that screening process today, it is a self-disclosure. We take the patient's word in that process. So just want to add that context, because if you haven't yet had the vaccine, you might be surprised with the number of questions, and they're all designed for your safety.
And it's a large subset of the population. Just from a theoretical standpoint here, if we were to ask everyone for that paperwork, it would extremely limit the speed and capacity of these events that we'd be doing. And additionally, honestly, that's a lot of medical paperwork that creates a lot of HIPAA issues that we would rather avoid. I would just kind of reiterate Rhonda and Hoyt from the county's perspective. We trust our population. Will a couple people possibly sneak in under that? Probably, but I think that generally most people are good, and they're going to check the boxes on the sign-in and the registration forms the way they're supposed to.
Okay, perfect. Thank you, guys. So I do want to have Michael go over our prioritization chart, if you can do that.
You bet, Veronica. Thank you. Yeah, it's a really good time to go over this. We post this everywhere out in the county, on our Facebook page, on our websites. We give it out to the media. It's the prioritization chart that we were required to submit by the CDC to the State Health Department, and it was approved several months ago. And so what I wanted to let everyone on this call know is we're currently in Group 1B. So we're going through, as Todd mentioned, Group 1A and administering the second shots. Gila County is with some of their community partners. And then we're also doing Group 1B, which is the education and child care workers. That's the teachers, that's the child care workers, and protective services, which is law enforcement. And we're working with those groups to get their first shot and then schedule the second shot. And then if you look down in the third box, the essential services, the critical industry workers, Gila County, after we finished Group 1A and Group 1B, the top two boxes, the education and child care and protective services, with their second shots, we will be working into the essential services box, while Cobra Valley and Banner and our other partners move into the very lowest box, the adults 75 and older. So you'll notice that on this chart that the one box that I didn't cover in Group 1B is the adults with risk conditions in congregate settings. We are currently working with the State Health Department and our community partners to locate the rest of this risk category individuals, the residents in Gila County who live in group homes that aren't really licensed through the state health department. And we're going to try and implement a program to actually go out there and do the vaccinations on site, since this is a high risk category. And so while the federal government works with the long-term care facilities and Walgreens and CVC, which they've already been into, I think, almost all of those facilities in Gila County for their first round of shots. We will be working with our partners to locate the adults with risk conditions in congregate settings. So that's where we're at right now. And I know a question earlier was, well, when can we get to the 65 and older group? And the 65 and older group is going to be after we complete the second shots for group 1A and group 1B all the way through. So I hope that answers a lot of questions out there. We wish we can go quicker, but as Hoyt mentioned, and Josh has mentioned, the vaccine volume is just not there right now across the entire country. Arizona is no different than most other states. We want more vaccine, we can give out more vaccine, but we're sort of limited by what we're given by the federal government. So, and that's what I have on the prioritization chart, Veronica.
All right, perfect, Michael, thank you. So this next question is directed toward Hoyt or Randy. I tried the banner link and it is full. They sent me to Gila County. Gila County sent me to Banner. What is the number to call?
I think we've kind of worked through that. It's one of our limitations. We will update that site. Again, weekly is when as we receive how many doses we will receive is when we update our schedule. And there are rare cancellations. So checking that, and I'll defer to Randy. Randy, I think you had mentioned Tuesday is our update typically when we release additional appointments. Is that right? And does that change?
So Tuesdays or Wednesdays, usually it kind of depends on the vaccine coming in. And I think the other thing to understand too is we're not trying to intentionally send people in a loop that feels like a runaround. But if you come to our website and we do not have availability, we want you to go to the Gila site because maybe there's an event going on that you would be available to you. And if we don't give you that direction, you just keep trying our site, you could be missing out on something else. So that's the reason for the redirect kind of back to the county website. And again, we've addressed it earlier, but to the point of everyone trying to answer the phones and take wait list is actually a disadvantage getting on a wait list because as soon as I open that schedule, online is filling it quickly. So that's the reason for the redirect back to the county.
Okay, perfect. And then this question is also for you guys as well. Any idea when the appointment scheduled for today, Wednesday, will be rescheduled since Banner was closed today?
Yeah, so we are going to start working on that tomorrow. We had staff that could not even make it into the office to be able to do it. So we already have a meeting first thing tomorrow morning, and we will be trying to increase what we normally do during the day to accommodate those patients as quick as possible. So you should start hearing from the clinic tomorrow.
Okay, perfect. Thank you. So this next question, it states that when are we getting any help in Payson? I'm going to direct this towards Todd or Josh.
Josh, I'll tell you if I can. Hopefully I've already answered it because I gave that list of, as I look at my white wall full of data in front of me. We've got 5 days of actually 6 days in Payson. So we have a lot of effort being pushed into there with our community partners and MHA and the LDS Church, just to name a couple, and the National Guard. We could not do this without the National Guard vaccinators to provide that talent or that skill to make sure we're getting vaccines in arms. So hopefully that answers your question. If you have any other questions, obviously I put my email out a couple times and I've already got a couple and look forward to addressing those after this.
Okay. I think the important point to see there is and I understand the optics that people are probably seeing, and what you have is with Cobra Valley and Hope and the public health clinic with Gila County and all these small clinics that we have in southern Gila County. we're giving out a lot of doses in small increments each week. So you might be seeing more registrations and that type of thing down south, whereas up north, we're working with Banner with some of them, and then most of the events that we've done have been the large scale events with MHA and with Dr. Michael Ponderosa up there. And, like as Todd said, he's been bringing in the National Guard to do these larger events where we're pushing out large numbers in a few days. So I just want to put that out there. I know that optics wise, it probably seems odd, but with the amount of vaccines that we can put together when we do one of our large scale events, in 3 or 4 days of our large scale events, we can do what the hospitals or clinics can do in a week or two, just because of how many people that we can put through. So as we've mentioned before, we have a spreadsheet that meticulously tracks to make sure that we're as equal as we could possibly be between the North and the South. And probably this will continue on forward, that you're always going to see a lot more large scale events up north to keep everything even. And you're going to see more through the clinics and healthcare providers down south. So,
and Josh, just to add that's benefit for both North and South is that we will be, we're into the second dose phase of healthcare workers, which is good news, because when those slots are no longer needed for second dose healthcare workers, they're going to be available for additional community vaccinations. And so again, we're climbing, and we should start to see some advanced capacity both south and north. I've just mentioned that perspective.
Sorry about that. So this question is related to, kind of related to the question we had about the clinics that you had to cancel today. It says, did the snowstorm have any effect on the clinics and Paysons that were planned? Do you guys, I know you said you guys are going to be rescheduling for today's. Were there any other clinics planned?
Yeah, so we had to reschedule 3 days of clinic this week. And so we are going to try to spread those appointments out over the next week or so to absorb them back into the schedule. So like I said, we'll be making those calls. We also had planned to have people from the Valley coming up to vaccinate on Saturday, and Hoyt did a great job today of finding more local people for us. So if there is another storm on Thursday, hopefully we can still open up on Saturday, because we'll have people from the community local that can hopefully get in to make sure we are still up and running on Saturday clinic.
Okay, perfect. Thank you. And then give me a moment here. Is the Johnson & Johnson vaccine available right now? What vaccine are you using? And this question is for Michael.
Thank you, Veronica. Well, good. I get an easy question. So we're using the Moderna vaccine. We have since the beginning, even though we have the capacity in the freezers with the equipment to hold the Pfizer vaccine. It's a much easier vaccine to handle and transport to our partners. So from the get-go, we've used Moderna. When Johnson & Johnson is going to be available, I looked today, and it looks like in the next 2 weeks, it might be eligible to go to the FDA to get emergency use permission for that. And if that happens, then it's only a couple weeks after that they will release that to the public. The importance with the Johnson & Johnson vaccine is it's a one-shot vaccine. So it would make all of our lives on the screen you're seeing less complicated, and it would be treated very similar to the flu vaccine, where you go in and you get one shot and you get immunized for COVID that way. So we're hoping Johnson & Johnson vaccine comes out soon, but until it does, we certainly will be using the Moderna throughout the whole process. Thank you, Veronica.
Okay, perfect. Thank you. Now, this is for, I'm going to direct this to Hoyt. How do the 75 plus group in Payson who do not have computers or email addresses sign up with the Banner Clinic? Is there a number they can call to assist them in registering?
We don't have a number that, for the reasons stated earlier, but we are excited about the CERT partnership that Todd Whitney referenced. So that I don't know if Todd, if we have a number yet, or more will be coming shortly, as I understood. But Todd, we'll be dependent in partnering with the county and CERT on that. Todd, do you have any thoughts on that?
County hotline and Carl, do you have it handy?
Could you repeat that, Todd? You were a little
We
quiet.
couldn't hear you, Todd.
Oh, sorry about that. It's going to be the county hotline, and I wasn't prepared with that. I don't know if Carl, you have that handy.
I suppose the question is, Todd, is have you received a date from the CERT team up north when they might be able to open up their storefront to have people available to help the 75 and older community sign up for COVID?
Can you hear me now?
Yes.
Okay. Yes, with everything else up north with the snow and the impact of the northern region, that's been pushed back just a little bit just because everyone needed to dig out to include our health building up north. So I don't have a date. I would say probably I'm going to shoot for a Friday. I can't promise that as of yet. And the phone number would be the one that is the 1-800 number. I'm sorry, the emergency number that Carl's been sitting on the last couple of weeks.
Great. Thank you, Todd.
Okay, perfect. So let me see here. Our next question here is for Stella. Stella, this question is, should I retest to leave quarantine?
That's a good question. We get that a lot. So if you've tested positive, we go by what the CDC and ADHS guidance is, and we release off of symptom-based. So depending on the type of test that you're getting to determine whether you have COVID or not, you can test positive for up to 3 months, while you're only contagious for about 10 days if you are not immunocompromised. So what we base our release from isolation or quarantine off of is symptom onset date, 10 days have passed, all symptoms have improved, and you don't have a fever for 24 hours. We do not recommend retesting. It can just extend your quarantine isolation time. And we again, follow the CDC ADHS guidance where we release based off of symptoms.
Okay, thank you. Now this next question here, give me a moment. This question is for Josh. If I have or had COVID, when can I get a vaccine?
Mute. And I might lean on Rhonda on this one as well. So the original with Moderna, and the most up to date that I've still heard is at the end of your quarantine or isolation period. So, or 48 hours past symptoms, whichever comes second. So it'd be the end of that quarantine, 14 days. Or if you were sick past that, it would be 48 hours past when you no longer had symptoms. Rhonda, do you know if that's still what they're using? I haven't heard anything official come down that's changed from that, though I've heard rumors of other people using different formulas.
Yeah, Josh. So there is quite a bit of information out there, and it's all very inconsistent. We've actually had quite a few people come through who had their first vaccine, then had COVID. And then when do you get your second one? CDC, the most recent thing I read through the CDC was that they recommend after symptoms have resolved. There is some literature out there that talks about the degree of your symptoms, and 30 days, 60 days, 90 days. I've read a variety of studies that give lots of different information. You know, anecdotally, you know, I've been watching people as they come through our clinic, and I know who our staff are who have had COVID or got it after. And it's been really interesting to watch their side effects from the second dose. Some are within a week of having been positive with COVID and they have 0. issues with the second dose. Some have other, more significant issues. So it really is all over the place. My recommendations have been to have people follow what the CDC says at this point.
Agreed.
Okay, perfect. Thank you. Now this question is, I was told by Banner Payson that there were no vaccines for 75 and over for 2 months.
I'm wondering if
Randy,
that,
you're complete.
I'm wondering if that question is that you want to take a stab at that, Randy? I'm wondering what they're thinking.
Yeah, I'm not sure. I'm not sure where that information came from. Currently, if you were to look today, there's not an appointment available, but we're not booked out 2 months because we do not go that far ahead, because we need to make sure that we have the vaccine available. So right now we have people scheduled through, I believe the second week of February, partway through the second week of February, and we'll continue to open up as we get more vaccine in stock. So that is not a true statement. As long as the vaccine keeps coming in, we will have vaccine appointments available for 75 and older. Like I said before, we're finishing up our second dose of healthcare workers, and then our concentration is on that 75 and older population.
Certainly apologize for any misinformation that was, or misinterpretation that occurred on that.
Okay, perfect. Thank you. We did have a question that came in. I have heard vaccine only lessens your symptoms if you get COVID. Is this the only benefit? I'm going to direct this to Rhonda.
I have not heard that, so I'm not sure I have a good answer. I have read nothing in the literature that talks about symptoms. Maybe somebody else has some.
Not a physician, but I would say that from the chief clinical officer at Banner and the research that we've tediously followed as we want to provide evidence-based medicine is the basis of this vaccine is such that you won't get COVID. And there's always that chance that you could, because no one can say it's perfect. But it's not like what you might see with the flu, where you have many different strains of the flu, and the scientists try to develop a vaccine that tries to address as many of them as possible, but it might miss on a few strains. The flu vaccination is very different. It's a broad spectrum. They look at the southern hemisphere to try to project what's happening in the flu strains, and there's many flu strains. And at this point, there are several COVID strains, but the vaccine is effective against the current strain. And Moderna confirmed that the UK and the South African strain that Moderna has studied and is saying that the vaccine remains effective against those two strains. Pfizer had not yet concluded. They may have today, but they had not concluded their evidence. So back to the point is, this is a more specific vaccine for a very specific disease. And so I would agree with Rhonda. I had not heard that you get a milder case of symptoms. The intention is to avoid the virus entirely and to build an immunity. And the studies, one other rumor I would address real quick, I think Josh has probably dealt with this and Todd, but there was the belief and perception that steps were skipped in the development of these two vaccines, and maybe even Johnson & Johnson may have had that same perception. What happened is in the historical vaccine development process, the FDA approval process, you would finish phase 1 before you were allowed to begin studying phase 2. And what's happened is the approval was given that phase 2 study group could begin overlapping phase 1. So it shortened bureaucratic time. No clinical hurdles were skipped. All of the veracity of the vaccine, it was as effective, or the verification has been as scrutinous as any other vaccine developed. So the social media and the news and other rumors that were spread that the steps were skipped, this vaccine is dangerous because steps were skipped, that's just not founded in truth and fact. So Veronica, my point being is, This vaccine is effective and it's been proven to be effective. And I have not read or heard from any of the studies that Banner has looked at that it's ineffective in establishing immunity against COVID entirely.
I love this stuff and would agree with Hoyt. So that, you know, the whole point of this vaccine and part of the reason we were able to do it so quickly is we've always used live inactive vaccines before, where basically the whole point, you know, it's to make it really easy is we get you sick with a limited amount of vaccine or a little bit amount of the disease, and that's how your body learns to fight it. This is completely different because what made COVID-19 the reason, you know, not to get into science, but the reason that an mRNA vaccine worked is because COVID-19 and all of the variations we've seen so far has a very unique shape. And we know exactly how it attaches to your cell. And what the mRNA vaccine does, to put it really simply, is it teaches your cell how not to let COVID-19 attach to it. So once you've had the vaccine, you wouldn't have lesser symptoms because if effective, which is what we're seeing, it can't attach in the first place to get you sick. Now, there's always an immune response anytime there's a foreign entity in your body. So you're always going to have an immune response. So you still may have a fever. You know, there are the possibilities of some kind of low grade fever or infection or something when this happens, because you may still have a foreign substance in your body that your body's, you know, working towards. But for it to actually attach to the cell and reproduce and give you the actual symptoms from the virus is unlikely because of the way this virus works.
And I would add, Josh, that there is, as you've heard, one of the fears of people receiving the vaccine is they hear about the side effects after the second dose. And you can have some after the first dose, sometimes a fever, typically lasts 1 to 3 days. And the same, it's a higher percentage who are having that type of fever or other type of symptoms. They're reviewed with you in the disclosure documents that are presented to you when you come for the vaccine, and you can see anything we're talking about in the CDC website. And that's one thing I would just tell you is if you haven't reviewed that website, there's more information than all of us together can possibly cram into our minds on that website. But the point being is that with the vaccine, it's effective. I'll just leave it at that. But
Okay,
and with the side effects, I was going to say that you have that fear. One point that I would add: Moderna's complication rate is 2.5 per million. That's lower than the flu vaccine by far, and I think Pfizer was 11 something per million. These vaccines have a very low complication rate compared to the vaccines we're accustomed to receiving. I would just add that.
Thank you all. And then we do have one final question here. Do you guys, and this question is directed towards Todd, do you need any non-medical volunteers?
The short answer is yes. We can always use volunteers. Currently with the closed pods, we're utilizing specialized staff, but as we start building out that next phase of general population, so on top of what we're doing now and building for the next 2 weeks, 3 weeks, we're also looking in advance, a month, 2 months, 3 months out. So definitely we would need medical and non-medical volunteers in addition to medical volunteers. And then I would steer you to the website COVID-19 vaccine at gilacountyaz.gov. There is no dashes in there. It's COVID-19 vaccine at gilacountyaz.gov.
Okay, perfect. I believe that was all the questions that we had for tonight. I want to say thank you to all of you guys who were with us, Michael, Carl, Stella, Josh, Hoyt, Todd, Randy, Rhonda. We appreciate you being here and answering all of our questions and, you know, giving our county more understanding. I believe that was it. Was there anything else that you guys wanted to add before we end the feed?
Thank you, Veronica. What I'd like to add is for the people of Gila County, the residents, we have people working weekends. We have people working 12, 14-hour days in the healthcare industry, in your public health department, in our volunteers. Our goal is to get as many vaccines as we get in out to you. The group we've created throughout Gila County is doing the best out of any county doing that. So what I ask is a little bit of patience. Give us a couple months while we get the second shots done, while we move into the other groups to get the first shots done. And we will make it through this together, but rest assured, our goal is to get everybody a shot that really wants one. So I really want to thank our community partners, and I do want to thank the elected officials across Gila County for supporting and giving us their support in whatever we ask for. It's helping everyone move this vaccine through the community quicker. So thank you, Veronica. And does anyone else have any last parting?
Mike, I was going to say, wash your hands. I'm not kidding. If I were you and you're anxious about the time between now and when you get vaccinated, the most effective thing we can do is wash our hands. Avoid touching your face, your mouth, your nose, your eyes. It is hard for me. The last 10 months, I have had to do habit changes. But masking works. It's evidence that it can reduce the spread for you personally, 5 times lower chance. From 1 in 50, from 1 in 5 to 1 in 50 by wearing a mask. I'd wear your mask when you're in public. Avoid social gatherings if you can. Maintain social distancing. Wash your hands. It's the most important thing, most effective.
Right. Thank you, Hoyt. And I think that's it, Veronica. So thank you, everybody, and have a great evening.
Thank you.
You as well. Thank you.